Hello, this is Smita Kumar, and you're watching Medicircle. Today, on our healthcare startup series, we have Ritesh Macwan with us. Ritesh is the founder and CEO of IndiMac Healthcare, which is based out of Anand in Gujarat. It is mostly considering the health, it's like we have the healthcare, different kinds of startups, concentrating and focusing on the different segments, right from elder care to vaccination to mental health. IndiMac Healthcare also gives this healthcare experience and assisted living for patients, including elders with chronic diseases, children, mother, and all the community after hospitalization or when required healthcare services at home to avoid the hospital visits. So let's find out more about IndiMac from Ritesh. Hi Ritesh, welcome to Medicircle Healthcare Startup Series.
Hi, Smita. Thank you so much, first of all, giving this opportunity. And I think you guys are doing a wonderful job. Thank you so much.
That's so kind of you, Ritesh. We definitely want to make Medicircle a dedicated platform because we definitely see there's a gap. We need to, interview more and more healthcare entrepreneurs like you who can talk about their products and services so that people who are going to consume them know about it. Or raising awareness is definitely one of the very important goals that Medicircle is helping the startup entrepreneurs with. To begin with, Ritesh, as the founder of IndiMac Healthcare, tell us more about IndiMac, when you started, and what was the reason behind it.
Okay, sure. First of all, that I am from the medical and healthcare fraternity. I worked for almost a decade in various hospitals and in healthcare field. So, being a healthcare professionals, I had an opportunity to interact with a lot of patients. In fact, I was interacting with a lot of discharged patients, and where I have find out that all the patients who are in hospitals when they are getting discharged, they have a main concern that they are all fine in hospitals, but at the moment they get discharged, they have this problems like how to get the medication done, how to what about their diet, what about their post hospitalization care, what about post operative care. So all sort of patients, they have these questions. Then I deeply did a research in that found out that elderly population is rapidly increasing in India. At the same time, these chronic illnesses, like they are also increasing in numbers, and this all sort of patients need more frequent and regular medical attention even after the discharge. They need proper nursing care and proper support even after the discharge at their home. So then I clicked this idea that this is one of the great opportunity, and this is really a pain point of the people even after the discharge. So we thought that we should provide something, we should create some product where they can probably get this kind of services at their doorstep. So I look at around this, why nobody is doing kind of why nobody is providing the services at their doorstep, right? At the same time, people are now, all people are working, right? We all are living in the nuclear families. We really do not have time. And at this particular point of time, right, people are really busy, and when they have to visit very frequently and regularly to the hospital, it becomes very painful, right? Even waiting time at hospital is again crucial problem. So I thought, let's create something where we can bring all healthcare services at patient doorstep and provide them comfort and convenience. And that is how we started in middle of 2019. And then since then we are providing all healthcare facility at patient doorstep.
Definitely, if you are talking about home healthcare, would like to share one data here that about 70% of those using home healthcare services, especially, are about the age or of the age 65 and above. So, in this age group, the most common medical conditions requiring home healthcare are heart diseases, diabetes, and cerebral vascular diseases. So definitely the need for these kind of aging patients, definitely they need to have more and more home health care. As you just mentioned about the elderly population in India, here also I like to add the fact that according to the report of Technical Group on Population Projections for India in stage 2011 between 2036, there are as many as 138 million elderly people in India in 2021, which consists of 67 million females and 71 million females. It's further expected to increase by around 56 million elderly population persons in 2031. So definitely, as in India, we have got a huge number of elderly population. Definitely, the need for such a startup where they are providing home healthcare services. Availability is definitely issue, that they are not able to visit hospitals that frequently. Second problem, how they are actually solving the affordability thing, because here also, like home healthcare solutions, they can be up to 40% less costly as compared to hospitals, as they utilize available capacity in patient homes, home healthcare solutions, or they also reduce this unnecessary hospital visits by up to 65%, because they are monitoring the health conditions and they prevent it from going critical. That's one very major fact, and saving more and more lives, and also reducing the overall operational costs of hospitals by 20%. So these are the two factors, I think, Ritesh, which is definitely helping startups like you, giving a reason to have more and more such organizations who are building up elder healthcare services. But let me ask you, what are the USPs of IndiMac Healthcare? Because there are other startups also in the same segment, like K24 is there, Zoctor is also there, who also provide home healthcare services to patients.
First of all, when I started this company, right, this is my basically a second startup. We are already into the education of nursing and paramedical. So during my research, I found out that there is one of in home healthcare, the biggest challenge is to hire the manpower, or to get a trained and qualified manpower who are ready to work at patient doorstep. But in our case, we already have our own paramedical and education institute where we are giving training and education to this paramedical staff. So that now we have already included this home healthcare in our syllabus, and we are giving training to all the nursing and paramedical. So we have huge local valuers with this nursing and paramedical staff, from where we can get the right manpower at right time. So that is one thing. Second is that we have a stringent mechanism of verifying the this healthcare provider, because it is very important when somebody is going to somebody's home and they are going to be their home. So safety is a major concern. So where we are doing a due diligence for all the service provider, the police verification will be done, their background will be checked, and they will be through our stringent training mechanism. And after that, only they will be posted at somebody's home. So that is what our two major USP. At the same time, we have developed our tech platform where client can easily book a service any point of time. Within 3 or 4 clicks, they can book the services. So we can become a kind of aggregator model where service provider can register their name into our platform, and client can book the services. So this is a 3 USP which we are following up, and of course affordability. Right, we are making sure that we should not become more expensive, rather than we are focusing on making it more affordable.
And tell us, Ritesh, how many lives you have touched so far with IndiMac Healthcare Services?
Almost we have touched 1,500 patients so far.
That's good. And is your startup bootstrapped, or you have received some funding so far?
It's my pleasure to announce in this platform. First time I'm announcing in public that we have been funded by US-based angel investor, and we have it's at the valuation of $1 million US. So we got the funding from US.
That's good. So definitely, when you get validations of your own concepts, your problem solving things, definitely they give you more and more dimensions and more focus to achieve your goals, which you might have when you started this. But when we talk about home healthcare service, Ritesh, don't you feel that accessing an app and also booking something would be a little bit difficult? So is it there for their kin or their, people around them, the caregivers who are taking control of it, or you have planned something else taxes, so that the people who are actually giving them home health care services, especially the caregivers, can easily access your app, because they will be definitely not those older generation people who may not have a very good comfortability with app operation.
Of course, initially we had these challenges like, this category of patients. Sometimes this elder population will not be much comfortable to the app. So we have our website also, where they can definitely access it. At the same time, from the caretaker and from the service provider also, we were facing this sort of problem where were not very comfortable. So we gave them a lot of training and all that to make sure that they are comfortable with the application. But at the same time, we are not only depend on the technology part. Of course, technology is important to scale up the business, but at the same time, we have opened all the sources, like anybody can pick up the phone and call to our call center and book the services. At the same time, service provider also have this freedom to access to all the field visitors and field coordinator, so they can be in touch over the phone and through the WhatsApp and all that. So we are kind of a hybrid model we are implementing.
And what were your revenues in FY 2022, and what you are planning to close at this end of the year, financial year FY 2023?
Yeah, initially in 2021, it was around nearly 17 lakh rupees in our first year. Second year, we did almost around 55 lakh rupees. And this year, we are aiming to close around 2.5 crore.
And as you have just raised funds, so have you, any plans how these funds will be utilized?
Exactly. We are recently planning to launch our services in Surat. So it's a good market again. And very soon, we are going to launch in Ahmedabad and Rajkot as well. So we have a plan that before this financial year close, we should be able to expand in Ahmedabad and Surat at least.
Oh, that's great to know. And any goals expansion, as you said that Surat and other places. So beyond Gujarat, when you are planning to scale up your services, because elderly population, especially when you talk about it, so it's a common problem across India, and generally the hilly areas. These are the areas where, and there are some remotest of areas also where these home health care services still are not being able to they are not able to access it. So any such plans for them?
Of course, yes, because we have a lot of, even a lot of leads and inquiries from other part of India, right? From Bangalore and from, other cities. So we have our plan, like our goal is to expand at least in 50 cities by 2025, right? That is what the goal which we are aiming for. And hopefully by 2027, we are going to become a unicorn startup in healthcare. So that is what we are aiming for.
And on the ending note, would you like to share any piece of learning with the fellow entrepreneurs who are watching this video at Medicircle today?
Of course, I can say that start early. That is the most important thing. As early as you can start, you should start. Start your startup. Sometimes what happens, the young entrepreneurs or young people, young students, or who are just passed out, they not able to take the decision that I want to jump into the entrepreneurship. So they should start early. And second is never give up. Right? No matter what happens, you should not give up at all.
So thank you so much, Ritesh, for joining us today at Medicircle Healthcare Startup Series and talking about IndiMac Healthcare. You are actually targeting a segment, home healthcare, which is definitely seeing lots and lots of changes, especially if you consider the market size. It is valued at $7.4 billion in 2021 and is expected to expand at a CAGR of 19.27% from 2022 to 2030. But besides that, there are many challenges also, like neglect of rural population, then emphasis of cultural methods, inadequacy of outlay for the health model, social inequalities there, medical research, definitely to be focused on drugs and vaccines for tropical diseases, and expensive healthcare services. Affordability would definitely be a factor here. So these are some important challenges. Hope IndiMac would also be considering them, and especially the whole home healthcare segment would be trying to go ahead of all of these challenges and try to help more and more elderly population with more and more available and affordable healthcare services post discharge. So thank you once again, Ritesh, for joining us today, and we wish you all the best and IndiMac for all your future growth, and also especially congratulations on the recent fundraise.
Thank you so much. Thank you so much. Last, I would add something, right? What you talked about. We have launched telemedicine, features in our platform as well, right? So we have a plan for this, people in rural area, right? They are actually not affordable for us, right? So we have our CSR project called IndiMac Foundation, through which we are going to cater this population as well, where we can provide them at least e-clinic kind of a thing where they can, consult doctors through these platform, and we can make healthcare accessible to them also.
That's good to know. Thank you so much, Ritesh, for joining us.
Thank you so much.